Precautions. Droplet precautions. This patient suffers from flu. People with flu can spread it to others within 1 to 2 meters away. Droplet transmission of flu viruses spread mainly by droplets made when people with flu cough, sneeze, or talk. These droplets can land in the mouths or noses of people who are nearby or possibly be inhaled into the lungs. Examples of diseases transmitted by large droplets include influenza, meningococcal meningitis, and pertussis. Precautions must be implemented to prevent droplet transmission. Implementation of droplet precautions. The patient should be placed in a single room if available, and the door can remain open. If single rooms are not available, patients who are infected or colonized with the same microorganism may share a room. Staff should wear a surgical mask when within 1 meter of the patient. In addition, the staff should perform hand hygiene prior to entering and immediately after leaving the patient's room. Airborne precautions. This patient suffers from open pulmonary tuberculosis. TB bacteria are spread through the air from one person to another. Airborne transmission occurs when the bacteria or viruses travel on dust particles or small respiratory droplets that may become aerolized when some people sneeze, cough, laugh, or exhale. They hang in the air much like invisible smoke. They can travel on air currents over considerable distances. Examples of diseases transmitted by airborne routes include tuberculosis, measles, and chickenpox. Precautions must be implemented to prevent airborne transmission. Implementation of airborne transmission. Patients with a suspected or confirmed airborne infectious disease should be isolated in a negative pressure room. Pressure differentials should be monitored daily when the room is in use. Healthcare workers should wear appropriately fit-tested N95 respirator upon entering the room. The respirator should be removed outside the patient room after use, followed by hand hygiene. Contact precautions. This patient has a wound infected with a multi-drug resistant organism. This type of infection can spread by touching the patient or infected surfaces in the room. Examples of diseases that can be transmitted through direct or indirect contact include gastrointestinal infections, including diarrhea of unknown origin, wound and skin infections, such as impetigo, and colonization with multi-drug resistant bacteria, such as methicillin-resistant Staphylococcus aureus, or MRSA. Precautions must be implemented to prevent contact transmission. Implementation of contact precautions. The patient should be placed in a single room if available, and the door can remain open. If single rooms are not available, patients who are infected or colonized with the same microorganism may share a room. Staff should wear a long-sleeved gown and gloves for all interactions that may involve contact with the patient or the patient's environment. In addition, the staff should perform hand hygiene prior to entering and immediately after leaving the patient's room.